Hi guys, Trevor Swenson back with PTSD Through the Darkness, my journey with PTSD and trauma and stressor-related disorder. Today I wanted to talk about a therapy that helped me that may be something you want to ask your providers about to see if it might be something that they would consider for you, if you might be a good candidate. For whatever reason, I don't know, I was considered to be a good candidate to go through this particular process. And what EMDR is essentially, I guess if I have to explain it in terms that I understand it well, and probably other people that aren't familiar with it will understand it, is it involves, the EMDR stands for eye movement desensitization, and it utilizes what's called bilateral stimulation. And bilateral stimulation meaning that both sides of your body are stimulated alternately, either with moving lights that you follow back and forth, or the EMDR process I went through had stimulation alternating going through my hands. And the best way I can describe it is a little bit like a windshield going back and forth. And one of the difficult parts of EMDR, and the reason that you need to do it with a professional, do it with somebody that is trained in EMDR, is that essentially you go back to the traumatic moments, the traumatic instances, the traumatic conversations, the traumatic situations that you were in, and you relive them to the most vivid and visceral way that you can. And while you're doing this, the bilateral stimulation, for whatever reason, you are able to then, with the help of the therapist, compartmentalize and set aside whatever those traumatic memories are. And I will tell you that the thing that EMDR helped me with the most, I shouldn't say that because there are two things that it helped me with, but the thing that it helped with that has made the biggest difference has been my anger surrounding the situation of my PTSD and how it developed. It had gotten to a point where I hadn't slept for about 6 months straight. And when I say I hadn't slept, it was not 24 hours of being awake, but wouldn't fall asleep till the wee hours of the morning, and then would be up for the day in the wee hours of the morning. And the time that I was trying to fall asleep, it was just a wrestling match in the bed, and it was very difficult, so much so that I actually had to sleep in a separate bedroom. So we had to fix that problem. And Murphy, my dog that is being trained, is actually being trained for sleep disorder, which I'll talk about in a little bit here. But EMDR has two separate aspects to it. It has obviously the negative aspect to it, to where you compartmentalize and relive those particular moments, and then with the help of the therapist, compartmentalize and leave them, set them aside, process them. And then it also has a very positive side that goes along with it as well. And isn't it interesting, right now in the middle of this video, that it seems like every time that I want to do a video, either a helicopter comes in for a landing or a World War II bomber flies over as a distraction. Unbelievable out here in the middle of nowhere. But the positive part of EMDR is just as important, because you are asked to focus on what you would call your safe place, whether that be in your mind or whether it be an actual physical place. And for me, it's actually a physical place. And a safe place, by definition, which I want you to spend a lot of time in your mind being there because it has helped me heal. A safe place is where you don't have triggers, where people are safe, and as a rule of thumb, you're very insulated. And that is my safe place, and that is the place that I'm asked to go to. Murphy, what are you doing here, buddy? Huh? Good to see you this morning. You're asked to go to your safe place, and the importance of the safe place is that just like you are able to go through the full spectrum of emotions with the negative and the traumatic, with the safe place, you are also able to drown yourself in the feelings of goodness that you would feel in that particular place. So for instance, my safe place happens to be the wilderness, and I think about planting trees by hand. I think about walking through new loggings on the property and looking for the trees from last year that I planted. And the key to it is, and I'll talk about it in an upcoming episode, is that I'm utilizing all of my senses. I'm drowning my senses in the experience, all very positive. I'm calm. I feel safe. My eyes are working. My nose is working. My brain is working, trying to remember where everything is, and I am very focused on something positive, which is looking for something within a very beautiful setting. And so all of my senses are being utilized as I make my way through a logging area, for instance, looking for all of the trees that I've planted over the last few years. Very healthy, very safe, very isolated, no dangerous people around, no triggers around. And you'll be asked to go there through EMDR as you finish each session. One of the things that I learned from EMDR is that they want you close in proximity when you do EMDR. They want you to do it early on in the week, because a lot of times those memories that you're asked to bring up and process linger for a number of days, and the not only the memory, but all of the triggers and the physiological things and psychological things that come from talking about those things and thinking about them and dwelling on them in as much detail as possible to get the highest reaction possible is at times very difficult to walk out of the office carrying that burden. And so they'll ask you to most likely stay close and keep in touch as you begin to process those healthy things. Another thing that has helped me immensely is that if I ever do find moments of deep peace and deep safety and calm and clarity and insulation and an overwhelming sense of well-being, because it happens so rarely now, I also use binaural beats in a set of wireless headphones on an app that I utilize on my phone, which does the exact same thing, except it does it with sound, alternating sound, binaural beats. And my therapist, for instance, asked me to only utilize that when I was feeling incredibly safe, when I was feeling really good, when I was feeling completely drowned in positive feelings overall, whether it be physical senses or mental senses, to condition my brain and to wipe my brain clean and to inundate it with very healthy, very calming stimulus. And that has really worked for me. For instance, I'll give you an example that may work for you. It may be a walk in the woods when you are feeling safe, when you are feeling calm, when your symptoms are very, very low, and you may want to throw in those binaural beats and just enjoy everything around you. Obviously, your ears, that sense, will be the cleansing sound that you're hearing, alternating bilaterally, but your nose, your eyes, your body, as you walk, your arms, all of this bilateral stimulation from looking side to side, your arms swinging back and forth, is shown in the studies that I have read to be very, very healing. So when you do ask about EMDR, I just want to give you the heads up that there is pain in the process, but if there's purpose in the pain, people don't like pain unless they know there's a purpose behind it. And I trust my providers deeply, and I knew the situation would be painful on multiple levels. And the interesting thing is that physiologically, as I went through the EMDR, they noted that a lot of things changed as I went through the very vivid memory of events that transpired over years. My breathing quickened. I had twitches I couldn't control. My eye movements started to go in rhythm with the stimulation that was happening in my hands, and my level of triggering went way up, which is a good sign when you're doing EMDR, because that means that you're actually processing the pain and the trauma that happened. But then I was brought back down in the subsequent set of bilateral stimulation to go to my safe place and to picture myself walking through those freshly cut loggings in the fall, looking for the pine seedlings that I had so particularly planted throughout the logging, with the smells of fall and the bright sunshine on my face, and being completely insulated from people and from triggers and from anything unhealthy. So my tip and technique for today is to ask your therapist if you would be a candidate for EMDR, understand kind of what it is, and have the courage, because it really did help me immensely. It helped me on the anger end of things, and it also helped me with the forgiveness end of things, and the not dwelling as much, as intensely on the negative aspects of my trauma. So I hope today's message was encouraging. I hope it gave you a tip or technique that maybe you can ask your providers about. It worked well for me. It would be awesome if it worked well for you as well, because as you know, on this channel, I want to share my story of pain, suffering, and loss that has turned into hope and encouragement as I have walked through for others what having PTSD is like, and also giving hope to those with unresolved trauma and a trauma disorder that you can heal, that there are great people out there that will love on you like almost nobody can, because they want so badly for you to be free from your trauma and to begin healing. So thanks for being with me. Please click and subscribe. It would be great if you replied, if you had questions. Hit the notification bell. I can't wait to see you next time. Thanks for being with me today.